that's not necessarily accidental. You have to bring to play then the legal ramifications of this, non-disclosure agreements. People are under gag orders, so they may or may not feel free to actually say this to their healthcare providers. And their healthcare providers, because of Act 13 and other things like that, may or may not feel free to even ask these questions. And even if they ask the questions, they don't have the amount of data and information for them to be able to respond to patient concerns. It's because there's so much data lacking, and you've got the legal ramifications. On top of that, it's a problem.
So I'm obviously not a health professional, but every once in a while when I read an article about health impacts, I'll see somebody saying there needs to be a large epidemiological study. I may not even be using that phrase correctly, but and I just was wondering if you could talk about your thoughts on that and kind of some of the benefits or not benefits of the need to do that kind of study.
I think it's sorely needed, and it's incorporated into our study design. So we have epidemiologists who are part of our study team, and I think the benefit that brings is a certain amount of scientific rigor in terms of study design, data analysis, that frankly, when it's presented to other scientists and policy experts, is the level of analysis that they want to see and are comfortable with. So I think I would agree with the statement that an epidemiological study is certainly warranted and it needs to be.
Yes, we very much intentionally decided that was not going to be our scope, and so I can only comment to the extent that we've chosen to not go down that path because we didn't want to get distracted by from taking action. So I think that those type of activities, we support them, we want to see them happen, but we don't want to see them delay action in the meantime. So if that were to take resources away from providing a tangible response to the community, that would be a concern. But at the same time, ultimately, I mean, is real political action going to take place without that? I can't answer that question.
Can I just elaborate one more point? So this is a problem that's not readily amenable to a traditional academic environmental health epidemiology study. And so the academic environmental health epidemiologists, they like to know what the exposure is that they're looking for. They insist on measuring that exposure in individuals and then linking it in a very rigorous and quantitative way to the outcome. Because of the complexity of what we're dealing with, I don't think that that's really feasible at this stage. And I've actually had some discussions with some very well-known and very accomplished environmental health epidemiologists who argue that absent that level of scientific rigor, you're not going to learn anything useful. We don't agree with that, and that's where we think that the approach we're taking, which is in many ways a very novel and innovative approach, using electronic health record data to basically do a population epidemiology type study, we think is a great way to get started. And we agree that time is of the essence, and the sooner we get this rolling, the better off we'll all be.
Now we've heard a little bit today about doing, well, I guess one of my questions is if you could both share a little bit about the cost of doing this type of work. We heard a little bit during your presentation, Raina, about that there's not state funding to do some of the work that maybe the Marcellus Shale Advisory Commission had suggested, and on the federal level, I've also heard there's maybe not as much funding as you might hope coming out of the CDC or other public agencies. So I just was wondering if you could talk a little bit about the cost of the work that you're doing and some of the funding concerns or issues that you're running into.
Well, I don't know if it impressed you, but what we're proposing to do, I think, is fairly ambitious and has a lot of aspects. So we've had a lot of discussions with government funding agencies, as well as private foundations and individuals. And I would say so far we've had the most traction with private foundations. And the funding we have to date is actually funding that came from a local foundation. It's funding we've done so far and will fund the initial pilot projects. One of the advantages of the approach that we're proposing is that, honestly, the health data, most of the health data that we're going to use for the study is collected as part of medical care in our region, so someone else is paying for that. We're leveraging that and using it for reasonable purposes. It is an extremely powerful and I think effective approach. The most expensive part of what we getting the data that we need to do the study is really the environmental assessment. We've talked to a very well-known environmental scientist who's part of our study team, and he's got a plan for doing large-scale water sampling, and his estimate is that to measure and analyze all of the components in water that he'd like to see, it would cost $1,000 per sample. So you add that, multiply that by 500 or 1,000 wells, and we want to do it before and after drilling, and maybe 5 years later, look at it as a function of well age, those kinds of things. You're talking about millions of dollars for this type of study.
So for our project, we're relatively bare bones, and it's probably very important for us in particular to actually get primarily our funding from private foundations, which we do at this point. It's definitely imperative that we wouldn't take certain funding, but the Heinz Endowments, the Cleneal Foundation has been an early supporter and a consistent supporter, so a huge shout out to both of them. And we've also gotten some support from the Pittsburgh Foundation in our area. So we've gotten a good amount of support from the funding community, and we've gotten a tremendous amount of support both from those foundations as well as from other people who've given us incredible amounts of in-kind support and expertise. So in that sense, we're somewhat well off, but we're trying to do a huge project, cutting it out, sorry, a huge project on a shoestring budget for the most part. I mean, if we are stepping in to do what the state of Pennsylvania ought to be doing with the state Department of Health, resources to do that, but I mean, because again, we can move so fast because we're not slowed down by really any of the political problems that might be out there. We can do a lot with a relatively small amount of money. So that's our focus, and again, we're trying to translate this also to the residents in southwestern Pennsylvania who are also trying to do a tremendous amount with almost next to nothing. And so, coming up with low-cost devices, coming up with ways that they can monitor for, with a $10, $15 piece of equipment, just to give themselves a sense of, okay, now we saw a spike, so that warrants further testing. But we're not going to, have that testing done without that at least basic information to alert me to that problem. And again, from the public health perspective, even with that minimal amount of equipment, you can start to make decisions to have better impacts for your health, such as, wow, something terrible has happened to my water. I don't know what it is, but I can stop drinking my water. And I do have a certain amount of information that confirms that.
So I have a couple of other points I want to make. So Geisinger, we're a non-profit private healthcare system, but a lot of what we've done up to this point, we've self-funded, so a lot of it's paid on our own time. The other point I want to make, and I'm going to go back to a comment that Dr. Oswald made about industry funding. And this is kind of, this may be dangerous, get a response from the group here as to how that would color your impressions of what we were doing. Because I've had scientific colleagues who have told me that if you take a dime of money from industry for this, I won't believe a word you say. On the other hand, I think Dr. Oswald's made a very compelling case for the fact that I think industry maybe should pay for some of this. And I think the analogy to the pharmaceutical industry is pretty apt.
we steal it from them, so we gotta do it. Tax them.
We can't do that. So if any of you have, comments or thoughts you'd like to share on that, I'd like to hear it. And maybe we can wait till the, I don't want to override our moderator, until the open question and answer.
Yeah, that would be great. And so something that you brought up, Raina, was that, obviously folks in southeastern Pennsylvania and a large chunk of Pennsylvania are not necessarily dealing with these issues in our backyard. And this was a challenge, I know, for the funding community to a certain extent in southeastern Pennsylvania. So I just was curious to ask you all this question about, why should folks on the eastern part of the state or the southern part of the state be concerned about this issue, and what are potential implications that might be statewide, but then also kind of might travel?
Well, that's a really good question for one reason in particular, because you're not so implicated in this region, so you have fewer irons in the fire. You can be more neutral, and a lot of the people in southwestern Pennsylvania struggle with that. I think because almost everybody has a stake in the game there. Even if you haven't done anything with the industry, chances are somebody in your family has, chances are your neighbor has, chances are your physician may have. Almost nobody in southwestern Pennsylvania, this is a big statement here, but none of us are neutral. It's incredibly hard to be neutral in that area. You may not necessarily feel strongly one way or another, but for you to have a conflict of interest is pretty typical. So again, this is where eastern Pennsylvania has more say and more power to influence things, because you're not dealing with the industry in your backyards. You don't have that person living next door to you who has signed that lease. You don't have your church community leasing. You're so much more neutral than you could possibly, it's hard, again, understand me when I say this, and I keep harping on this, it's hard to believe how pervasive their influence is in our area. And it's every single person you meet, it's in everybody's conversations, it's on their lips. So again, you are outside of that area, so you have a lot of influence because you're neutral. So much more neutral than we can be.
No, I agree with that. I don't have much to add. I think as a Commonwealth, this is a problem that's going to impact directly or indirectly everybody who lives here. In Philadelphia, you are in the Delaware Valley watershed, which is part of the area that will be impacted by some of the activities in north central and eastern Pennsylvania. So
I think we'll do maybe one more question, and then we'll get, it looks like there are a lot of cards, so that's terrific. I'm glad to see that, and we'll try to get through as many of those questions as we can as well. So the earlier presentation kind of looked at the health effects on animals, and I was just curious if either of you have seen any cases or aware of any kind of food supply impacts and how that might be borne out in human health. I'm sure that's a question that was important for a lot.
Right, and again, unfortunately, we're dealing with a scarcity of data there for people to understand. I can say, from my own personal perspective, and I've talked with people, some really key leaders in my community who said, I no longer feel comfortable eating locally, buying locally, supporting local agriculture. And that, to me, is bordering on tragic, because this is an agricultural state. That is one of our top economic drivers. And for the agricultural interest to all of a sudden be threatened overall for the ranchers, and farms are disappearing. That's the other thing, is that farmers are selling out because there's no reason for them to stay in it. That actually might be the good news, because in some ways, if they've leased and they've got these want them raising their cattle anymore. But that's still tragic, because guess what? We all need food, and we all need water. So we can't allow all of our farmland to be leased and destroyed. I mean, I'm from out west, actually. I'm originally from South Dakota, and I drove out there recently and saw the drought, and saw the tremendous impact it was having on the cornfields. And I come back here and I see these lush green cornfields, and I think, people, how precious is your water? How precious is your land? You can't sell that. You cannot sell your water quality and survive.
We've not actively sought that kind of data, so I'm really not aware of anything other than what we heard about this morning.
Now, was somebody collecting the cards? Walter, do you have them? You want to pass a few up?
And I wanted to make one last comment on the earlier question, which is, we're all downwind and we're all downstream.
I'm going to do my best to see if I can read some of these. Yeah, I guess so. Sure, or I can read it if you want. So I'm going to read this. This question is, what is the Pennsylvania Department of Health's view of your study given accurate team, which limits doctor disclosure, or disclosure to doctors potentially on hydraulic fracturing?
So the Department of Health is very supportive of what we're doing. Secretary Mila has written a letter of collaboration to share their data with us as part of the study, so I think that's a very positive sign. With respect to Act 13, we've actually discussed that with the impact of that on the study with our legal team and our public relations team, and their interpretation is that that will not have a negative impact on our ability to do the study as we're proposing it. So, because the data that we're collecting is data that's collected as part of routine medical care and would not be subject to that. So we're not, it's really not had any impact at all in terms of what we're doing.
Are you seeing implications on the region from concerns about Act 13 and the disclosure?
Yes, and to some extent, no, just because again there's that wall of silence.
So this question is, what do we know about the health impacts on employees who do the fracking, and do they wear protective gear, and either of you had much contact with the workers in that context?
I'll say a couple things and then hear from anyone else, but yes, and one of the problems that we see and a concern that I have based on what we've seen is you might have some responsible companies out there who are trying to do the right thing. Then you've got subcontractors. And the subcontractors, guess what, are not necessarily following the rules. If those rules were even strongly enforced, they have less incentive to play by the rules. And so that's where, in some cases, I think we may be seeing more concerns with the worker populations in particular, is you've got these subcontracting companies who are breaking the rules, basically. We're not following OSHA, and OSHA doesn't appear to have a very large presence for this industry. So, again, you know, even with a strong OSHA presence and with some companies who are trying to do the right thing, you would still have that subcontractor issue.
I can make a brief comment about that. One of the things that NIOSH has done is to study a bunch of drilling sites. And one of the things I find is that the worst problem is the sand that's used as a proppant. Apparently, some of the drilling pads in the middle of fracking operations